So the sequence that we do, so now you're doing something definitely in a sequence, okay? So it's the buckle of 1 through 16. And then you come around and you do the lingual of 16 to 1.
Okay.
Then you drop down and do the buckle of 32 to 17, and then lingual of 17 to 32, and it's on your handout, okay? So, I'm just going to kind of walk you around this so you can kind of see it. Let me move this to get my thing out of the way so I've got any more chin up. Okay, so some of the position, every position is going to be the same, kind of. Don't you love that? You have a couple options in some places, okay? So here's our favorite spot. Section 1 buckle, right? Okay, so one thing they were saying in the textbook is if I go in here, okay, let's be realistic. He's got, 3 and a little bit more openings, so he's opened super wide, and a lot of your patients are going to be near that wide, okay? So I could probably get in here and drop my hand down and get that angle on the third molar, but they're saying that in a lot of patients that's not possible. So they're saying that if you swing out to the side, it will help you get that angle. And then we're going to also show you in your partner's mouth that you can create a fulcrum by making a little cradle on their chin, and they close down a little, and then you can swing out and get that way back there to do that distal. But we'll work on that later. So again, I'm trying to be as parallel as I can. So I have 2 options. I have the option of my fulcrum, changing my angle, and I have my handle position on my hand, okay? So to help me with that, then I can drop down a little bit, see how that changes my angle, okay? So I can start on the distal buckle of line angle of number 2, and so I'm going to fly in and land, and then I'm going to change my angle. I'm going to try and picture that where it's sloping inward, and I'm going to land there, and then they say just slide underneath. So if you go to do this and you catch on your tissue, you're probably not adapted, and that's one way to help you. Although these probes are just bulky enough, they're going to catch a little bit sometimes, okay? But I can drop my hand and slide in there and adapt, okay? And then I've still got to figure out how to get my arm to move. And here's this one spot where you can see I've got palm down, so that my motion is making my probe go this way. You can also come in from the side, but this one's a little harder to activate, but you can do it. So it depends on which one works better for you. So it's doable to come in from the side, and I'm kind of doing that sort of modified motion. So I just step it along, step it along, step it along. Okay, I can't go any further. I'm going to pull back on it and angle just a little bit more dramatically and just take one more push into my call. Then I take it out. I come back to the line angle and make sure that it's angled out a little bit so I can stay adapted to the root. And I start at the line angle, and I'm just going to take these little motions and step it around. And I just keep going until I can't go anymore. I'm going to pull back, and then I go in one more time for the call. Okay, and then I'm going to reposition. So essentially, we're kind of doing this type of motion. As I work my way more anteriorly, then I pivot up to get into the mesial. So I'm going to drop down, go into that line angle. Can't go any further, pull back, angle a little bit more, I'm in the call. Pull it out, go back to the line angle. And so now my pivot has kind of changed to help me get my stick around the tooth. Okay? And so, can't go any further, and then I angle. So look where my hand ended up. And here's where I started. And that's kind of what you have to sort of think. It's like you're trying to work that stick around the tooth like this. Okay? So I start down again, and I go into that distal. There's my call. Come back to the line angle. has rotated around to help me, and I've still got that probe angling in toward mesial. Okay, I'm going to reposition my fulcrum. This is the fun part, is like, where does my fulcrum go? I've got a guide for you on that. That'll kind of get you around. And see how much higher I came up to kind of keep myself adapted, and I ended up here. So here's where I ended up, and here's where I started. Okay, now I could keep going this way for my anteriors, and what it would require is that I basically kind of do this type of motion. Okay. Now, once I get to a certain, well, I can pretty much see everything I need to see until I hit the canine, and then I'm going to have to do something here at the canine because I can't see around the corner. Your other option here is to do these anteriors from the 12.
Okay.
Okay, and that's why I was saying you do have some options. Okay, but if I do it from the 12, now I've got a whole different position because now I'm going to come this way. So I've got to angle in toward the 2. So again, I come in here and I'm going to have it down in the V to kind of help that angle, right? And so I can start here. And I think for a lot of students this is easier.
I think so.
Yeah. And then come back to the line angle because I can do this little doorknob here. The thing I was talking to Alma about, you want to get out of the habit of doing this and swinging your probe into the tissue. Your stroke, you want to keep it vertical. Now I'm kind of stuck here. Like once I hit the line angle, I really feel like my position isn't so good. So I'm going to take it out, and I'm going to scrunch up a little bit on my grasp like this, and I'm going to come closer and reinsert at the line angle to finish the canine. Okay, and there's my call. Jump over to this tooth. I'm already kind of at that angle anyway. And just make sure that I'm angled. It's the call. I'm going to reposition my fulcrum at the line angle and come around. It kind of depends on the size of your hand and how stretched you feel, but sometimes I'll take it out at the line angle and come closer and go back in. Like that. Okay? So I come around and I do all of these, and then I end up, I'm just going to swing it over and run over you. Okay, so I'm going to end up here, right? And I'm using my mirror, and I'm just going to keep going, okay? So I'm basically in that 10 or 11 o'clock, and here I am surfaces away, right? So I can just keep going, but now I'm doing mesial buccal distal because I cross that midline. So I've still basically got that same hand position going in there. Come a little closer with my fulcrum. Pivot up on my fulcrum a little to get me around the distal. And here's where you really need to start using your mirror. You cannot see around the corner. I know you think you can, but you can't. So you always, anytime you can use direct vision, do. But you've got to be able to just rely on your mirror once you hit that distal line angle, because you've got to be able to see into the interproximal, and there's no way I can get that reading without using my mirror. Okay? So, excuse me, so then I just keep going, right? So I've kind of basically got that same hand position I did with exploring. I'm going the opposite direction at the moment.
Yeah.
I'm not coming from here forward, I'm going back, which is a little weird. But I remember this beach ball thing, guys, some of you that were practicing with me, trying to keep my wrist neutral. And you've got to learn to kind of keep a space between your body and their head, and be willing to bring your arms out a little bit. And then I'm just pivoting on that fulcrum. It's very different, though, because, again, it's a straight stick, right? And I'll just tell you right now, third molars are just a beast.
Sometimes you can't even get the distal.
You
I mean,
can't.
you just can't.
You
Especially
can't.
if they're out of the occlusal plane.
Okay.
There's a different probe that we have a couple of them, and they have like a right angle to them, which is meant to help you get third molars sometimes that you can use. But yeah, sometimes they're just the pits.